Hello everyone and welcome back to my channel. Dr. Yogi here, and it is so good to see you today and be amongst the presence of greatness. Yes, you are great, and I hope your day is going lovely. Today's vlog is to show you a typical day in family medicine, so come and join me if you're interested. Sorry in advance for the vertical videos. I didn't realize when I was doing that how it would translate to YouTube, but you know what? First time, I didn't do so bad, okay guys? Also, don't forget to like and subscribe and share this on any platform where you share cool stuff. All right, let's get to it. Typically how I start my day is I wake up around 6:15 and let my dog out, feed her, walk her, and then I get dressed to go to clinic. The commute to clinic is about 50 minutes. I work in a rural clinic and I'm interested in rural medicine, so I don't mind the commute. It's actually kind of relaxing when you get used to it. You turn on some tunes, turn on a podcast, and you're good to go. It's also a good way to decompress on your ride home if you had a tough day in clinic or you had a tough morning in the hospital and now you're going in for your afternoon clinic. When I arrive to clinic, I go through my back door, drop off my stuff, and then I proceed to my particular nurse's station. With everything going on with coronavirus, we're doing things virtually, meaning we meet with our patients over the phone or over the internet if they have video capabilities on their phone, and it's really just to keep everybody safe. But when I'm here in the clinic, we do see some patients that can't be seen via virtual visits. For example, I had a Nexplanon placed. This patient had had the Nexplanon, which is a method of birth control, had it in for 3 years, was due for renewal, so she came back and got it done. So we had to remove that and place the new one today. I tell you, boy, these Nexplanons, they can be a little tricky when you try to get them out. They're really easy to put in, but a little harder to get out. But they're a very effective method of birth control for people. And then I also had a blood pressure follow-up. This patient pretty much was coming in because her blood pressure cuff at home was reading high. And so when she had a virtual visit 2 weeks ago, she was told to come in so we can verify what her blood pressure cuff is doing. A lot of people will get those wrist blood pressure cuffs. I will say, in my experience, those tend to be a little more inaccurate because it tends to make people's blood pressure higher than they actually are. So for her, when we checked her blood pressure with our cuff that goes around the arm, she was in normal ranges. And then I had a person coming in for more of a psych visit. She was having mood irritability and anxiety, so we followed up about that. That was through a virtual visit. So I'm saying all this to say family medicine is very diverse. You don't get bored because you're always having to think of what the next patient needs or how to help them. So kind of keeps things exciting. So anyway, gotta go back to work now. All right, y'all, so I am leaving the clinic. I finished my work day. I am leaving a little earlier today, which I will not complain about. So anyway, my day pretty much wrapped up with the patient who was coming in with the complaint of abnormal uterine bleeding or bleeding outside of what's normal for her period. She did have an IUD placed, which is a different form of birth control. Was doing fine with it, but then recently over the last couple of weeks noticed that her bleeding was a little more just kind of evaluated her, made sure the IUD was in the right place, made sure that she wasn't pregnant. That is scary. You have an IUD in place, you're like, I shouldn't get pregnant, but no, birth control is 100%. So you always want to check that, make sure it's not something like that. But it's definitely one of the most effective birth control methods out there. Did an ultrasound, make sure it wasn't anything that I could see that was abnormally wrong. So we're just gonna monitor how things progress. Might just be a new symptom of having an IUD. For her, everybody's body is different, so treating that with medicines like ibuprofen, and then we keep a close eye on it. If it's not getting better, of course we've encouraged her to let us know. She might be someone that maybe the birth control method she chose isn't really working well for her body, and she might decide to take it out. There are no wrong answers, honestly, so we'll just see. We'll keep an eye on things, but I am on my way home, so I will check y'all later. Well, that about wraps it up for a typical day for me in family medicine. It's a little different now than it was a couple of months ago before Corona, but you get the gist of it. If you want to see more of this, don't forget to like this video, don't forget to subscribe, and if there's something else that you want to see in particular, leave it in the comments below. And leave a comment below, tell me about a good experience you've had with one of your doctors. Well, until next time, bye!